My name is Kate Ahrens, and this is my presentation on interventions for blindness in early childhood, where I will discuss the impacts of early childhood blindness on children's development and potential intervention. Around the world, an estimated 2.2 billion people have a vision impairment, and at least 1 billion of these vision impairments could have been prevented or are yet to be diagnosed. In children, the main cause for vision impairment or blindness is retinopathy of prematurity, also called ROP. ROP is caused by underdeveloped retinal blood vessels in the eyes of premature infants. There are 5 stages of ROP, with stage 1 being very mild and no treatment required, all the way up to stage 5, resulting in blindness despite surgery or treatment. Depending on the stage of ROP the child has, there can be slight vision impairment all the way up to total blindness. According to the National Eye Institute, doctors usually start treatment on children in stage 3 in order to prevent worsening of the disease and future vision loss, since it is possible for the stage of ROP to worsen quickly. The best practice to do is to make sure that children are getting frequent checkups and eye exams to further prevent worsening of the disease. Although there is no guaranteed way to prevent ROP, the best prevention is to take steps to lower the risk of premature birth. If premature birth cannot be avoided, doctors will perform eye exams on the child every few weeks. If stages 3 to 5 of ROP are present, treatments such as injections, surgery, or laser treatment will be implemented. Intervention for ROP in early childhood blindness includes schools for blind children that give them access to occupational and physical therapy, speech therapists, and specialized education in order to help blind children develop in all areas of early childhood, especially the areas of development where they may struggle, such as language or social relationships. In early childhood, a key piece of development is children learning to understand their surroundings. A key piece of this development is being able to learn through sight. Children at a young age learn a lot of developmental aspects through observing others, observing other children, parents, reactions, interactions, body language, behaviors, cause and effect. This can interrupt a child's concept of self and others. Another important piece of development in early childhood is play. Through play, children learn to socialize with others, build connections, navigate relationships, and more. For blind children, play is much harder to engage in and oftentimes develops much later than in sighted children. Because blind children struggle with play and being able to understand social cues such as body language, they may be delayed in social aspects, as well as building relationships with others. Children in early childhood are also expected to be developing with speech and communication. Blind children often have delayed development in these skills because of the absence of association between object and word. Vision enables sighted children to perceive objects and their context and therefore aids in language development. However, since blind children cannot see the object or the thing associated with a new word, it can be difficult to understand the correlation. The disability model and theory that best aligns with intervention for childhood blindness is the medical model and Braun-Fenbrenner's ecological system theory. The medical model best aligns with programs for blind children because it focuses on treating and minimizing the developmental effects of blindness through teaching and therapy. Braun-Fenbrenner's theory also aligns with programs for blind children by demonstrating the individual, microsystem, and macrosystem levels that are all a part of helping blind children develop. Schools for visually impaired and blind children are specifically designed for blind children's needs. These schools keep the challenges blind children face in mind while teaching all subjects from math to English and connect blind children and their families to other resources like multiple types of therapy, such as speech and occupational therapy. These schools specifically relate to the medical model by trying to minimize the effects of blindness by understanding the best ways to treat and teach those with blindness, and also to aim to help blind children develop quote-unquote normally as a seeing child would. These schools aim to help children develop cognitively, socially, and emotionally as most children in early childhood stages do. Research supporting this intervention approach is demonstrated by Lloyd and Dawes' article, The Power of Getting Education Right for Disabled Young People, discussing the importance of specific and specialized plans for disabled children. Lloyd and Daw quote Mu et al.'s study on education for disabled students, saying, quote, research which found that when teachers actively seek resources for their students, the resilience of disabled students increases. Lloyd and Dahl also touch on a specific example from their project Luna, saying, quote, "To illustrate this, we want to share an example from a Luna volunteer. A. During year 12, A's health declined, and they were unable to attend the sixth form for 3 months. When they did return, they needed to use a wheelchair, and because the school was physically inaccessible, they needed the support of teaching assistants to navigate the space. They hated the idea of this, feeling embarrassed and like a burden, and did not want to return. However, the teaching assistants were friendly, treated A like the adult they were, and took the time to learn about their hobbies and interests. They were patient and always consulted A to work out how to make things work best. Ultimately, they made attending school both possible and enjoyable." This intervention approach is promising to the target population because it is specifically designed to cater to the needs of blind children. Blind schools increase blind children's learning and success rate by developing a learning plan most effective for each child, depending on the medical and educational assessment for each child. Early intervention for blind children helps to support children's development in early stages, but the later stages of development are also extremely important. I believe future research should focus on creating plans for early development that move on to later development. In early intervention, we set our children up for success, but it is important that we make sure success is reached in their future through creating plans for children as they age. Early intervention of specialized learning and development plans are not only for blind children and can be used for children with all different types of physical and cognitive disabilities. Ensuring that children with disabilities receive the best care for them to develop and succeed best is the main goal for early intervention education programs. My name is Kate Ahrens, and this is my presentation on interventions for blindness in early childhood, where I will discuss the impacts of early childhood blindness on children's development and potential intervention.